everyone. This is Dr. Sullivan, and I am back with you from my office. I have not been here for a couple Facebook Lives now, but I am here tonight because we are getting ready for our Essential Tremor webinar. We are so excited about how many of you have signed up, and we have been working so hard and so passionately to make the most informative and helpful 4-hour learning extravaganza for all of you awesome people out there. As I was doing one of my lectures, which is about how your symptoms meet the world, the social part of having ET, there was one little subtopic about the informal caregivers experience, which is just your loved one, someone you share your life with, that maybe sometimes gives you a helping hand. And it just didn't really fit into my big picture, and we're already so over with our amount of slides because we're so excited and we just keep piling on and on, that I decided, let me just pull that out and just make it a Facebook Live. So that's what we're going to talk about tonight. There is about 1.5 more days to sign up for our webinar, and there will be a link in the comment section. We've been so honored, really, to see how many of you trust us to be your guides. And our goal is to really meet the unmet needs in this community. There are just so many things that happen in ET that really just are invalidated and not assessed, and then of course not treated. And so Dr. Renfro and I are really trying to take that serious, to try to lay down some really good groundwork for folks to figure out how to feel better. So when I say caregivers, I bet some of you with ET who are watching me are like, I don't have a caregiver. The impairments in ET are typically not severe enough to the point where you need a caregiver, okay? So maybe we should try to find another word, but this is what the research literature names people. So obviously you don't need 24-hour care, but you might have people, and tell me in the comments if I'm correct, that cut your food for you, fasten your buttons, write your checks, do your forms when you go to see the doctor, help you with the phone, maybe if you have a vocal tremor, that kind of act as like an interpreter for you sometime. But what we really know, the role of the informal caregiver in ET, is that there is emotional care and support that I hope you are given, maybe not consistently and maybe not perfectly, because people aren't getting any training on this. But I do think it is an important area to talk about, and furthermore, there's actual research on it. So I always want to share with you guys, kind of be the translator for what's out there in the scientific journal articles. So when you think about caregivers and you do the research, almost always you come up with topics related to caregiver burden. And there's a part of me that loves that, because it is hard to be a caregiver. I have been a caregiver. I know that it is a 24-hour job. It weighs on you in every way. It is heartbreaking. But the truth is, there's also an under-neglected side of caregiving where people are serving someone that they love very genuinely. There can be a lot of joy in caregiving, not all the time, but there can be moments of transcendence where people really feel like they're serving the love of that person. For some people, it's very spiritual. They're serving, a sense of God and holiness by being caregivers. So that was just kind of my first soapbox comment. So if you go into this literature, it's almost all about what is kind of difficult about caregiving. So they talk a lot about how visible and invisible symptoms affect caregivers. And I think that is so helpful in ET, because one of the points I'm going to make to you on Friday in our webinar is that that's really the truth when it comes to ET, is we have focused almost exclusively on the visible, on the tremor. But much like an iceberg, there is many, many, many things that are going on that are invisible. People don't understand the cognitive stuff. I learned a lot in my research for this webinar. There's stuff going on with hearing, with smell, with sleep, emotions, word finding. It's amazing the things that don't get talked about with essential tremor. And all of that is invisible, right? And people, even if they know about ET, they're just like, okay, you have a tremor. Well, absolutely not. There's so much more that goes on that's invisible. So when people have an invisible disability, it turns out that is a whole nother experience, and that is a whole other set of challenges, because people don't see it, and they're there can almost be questions sometimes, like, is this person really, having trouble in this way? Well, I mean, all I can see is this, or even if you go to medical professionals, sometimes the focus is so exclusively on the physical, objective, visible symptoms. So I do these talks because I want you to know there's a lot more going on, and I want you to feel validated by a neuropsychologist about that stuff. So in 2019, there was a study that came out by a Dr. Hickman, and what he did was pretty cool. He asked 98 people with ET and their spouses, their care partner, a series of open-ended questions. And basically just asked them, like, what do you think your role is as a caregiver, a loved one to your person with ET? And there were 3 themes that came out of this research. The first one is that these folks really see themselves as providing companionship for their loved one, kind of like a social partner to go out and navigate the world with. The second one is promoting independence, wanting to be there to help them in some ways, but really the goal is so that they can continue to be themselves in the same independent way that they were before. And third, which is a big theme in the webinar because it's huge in the ET literature, is reducing embarrassment. Embarrassment about the shaking causes so many problems. And what really breaks my heart is that not only do we not ask that question on a routine basis, but people with ET are given no training, clinical skill building on how to manage the embarrassment. And if you don't manage it, and it goes on its natural way, the truth is it tends to get worse and worse over time, and then we've got much bigger problems. So in general, caregiver stress and ET stress were about the same in this study. So they basically asked the person with ET, how much do you think ET stresses you? And they said, this number. And the caregivers were actually right on track. So that was really nice to see. But there was one difference, which was that the caregivers really didn't seem to get the struggles that come when you have ET, when you are put into a social situation, especially when you have to do things like eating and drinking in front of other people. And if you think that this is right, please tell me, because you all are the experts. So you tell me if you think that they're actually onto something here. So this was interesting because it really tells us that we need to be supporting people in talking, people with ET, we need to support them in talking more about what is hard for them about eating and drinking in front of other people. Because when we don't address embarrassment, what's very normal is that people start to withdraw from social events and they turn down invitations. They don't want to go to public functions. They don't want to go to anything where they're going to be on display and their tremor might potentially be the subject of attention from other people. So when the person with ET does this, what this research study suggested is that the caregiver, the care provider, is at pretty high risk for depression. And I thought that you all would want to know that, because it's another motivator to want to deal with your own stuff as someone with ET. Because I have found as a psychologist, oftentimes people are more motivated when it's not about them, right? So if I say to someone, I really want you to do this, it's going to make you feel better. Sometimes you get a little resistance, but if I reframe it and say, well, the truth is, I think your husband's having some issues and struggling. Oh, okay, right. Well, let's talk about counseling. Maybe let's talk about how to face the fears that I have. So if you don't want to do this kind of stuff for yourself, hopefully you might think about how does it feel to be your spouse or your partner. So there was another study in 2016 where they took 57 folks who had ET and their caregivers together. And what they did is they measured the person with ET's level of embarrassment and how much the caregiver was perceptive of that embarrassment. So again, the question was, are they both in tune with each other? And this was just another study that really reinforced the idea that they're very much in tune. And the conclusion that they came to in the study was that stress and embarrassment is contagious. And it's something that you can really pick up on when you care about someone. And because there's shame that surrounds the emotion of embarrassment, a lot of times people are just not talking about it, and it's kind of becoming this like elephant in the room in people's relationships. So in one study, they also asked a question of both the caregiver and the person with ET, and they wanted to see how much they agreed. So the first question was, my tremor is embarrassing to me. So what would you say as you're sitting here watching me now? Do you feel that at times you struggle with being embarrassed? Well, about 83% of folks with ET said that they do feel embarrassed at times, and about 86% of caregivers said that they perceive that their loved one is experiencing embarrassment. So that's really pretty unbelievable, right? So the two statements that were most together, most aligned, were the statement of, I am embarrassed by my tremor when I am in public, and I am embarrassed because it makes it difficult for me to write. And probably because the caregiver is the one that kind of steps in and does those tasks for the person. But there also were some statements where the caregiver and the person with ET were really far apart. So the first one was, I am embarrassed by my tremor because other people might think that I'm nervous. So 62% of people with ET said yes, that was true, and only 19% of caregivers said that they thought their loved one was having that experience, okay? The other one was the person with ET, 50% of the time said, I sometimes try to hide my tremor, and the care partner only said yes to that 14% of the time. The other one was, I'm embarrassed by my tremor when I have to speak in a group, and 37% of folks with ET said that that was true, but only 14% of caregivers did. And the next statement was, one of the reasons I take medication is that I am embarrassed by my symptoms, and 37% of people with ET said yes, whereas only 14% of caregivers said yes. And I can tell you from my research for the webinar that embarrassment, more than tremor severity, so how bad your tremor is, and more than tremor disability, which is how much does your tremor reduce your functioning and your independence, embarrassment is much more tied to how much medication people take and if people choose to pursue deep brain stimulation for ET. So how interesting is that? So what can we learn from all of this? What am I taking away from this? Well, the first one is that, of course, your friends and your close family, they're having an experience with ET as well. It's just vicarious, right? You're the person who lives with it inside you, but it doesn't mean that they're not having their own experience. And so I would love for you to open your mouth and open your heart and just have a conversation with your person about, how does this affect you? Do you sometimes feel like I feel embarrassed and you're not quite sure how to help me? Or, do you give me that word I can't quite remember? Do you let me try to figure it out on my own? Those are really actually very important questions. We also know that caregivers in ET are having a significant emotional experience. When people come to a neurologist and they have something like Alzheimer's and they come with a caregiver, what actually happens is a lot of the attention goes to the caregiver. The person actually becomes almost like an object in the distance who doesn't really get asked their opinion, is not necessarily included. I wonder if we actually have an opposite situation with ET, where because there's the stereotype that ET does not have cognitive symptoms, I almost wonder if the caregiver's experience is actually being kind of ignored. So I would love for you to give me feedback on that. Do you ever have your specialist ask your spouse, how are they doing? How are they coping with the fact that maybe you don't want to go out and do as many public things as you once did? So this also has very big implications for how we can help caregivers of all kinds with counseling. So if some of you are out there and you sense that your spouse or your loved one is really struggling, counseling and talking about it and getting skills is a very, very truly helpful thing to do. But what we now know is not all caregivers are the same. The caregiver experience in Alzheimer's is going to be very different from the caregiver experience in essential tremor. So please try to find a counselor, if you choose to do that, that actually has expertise in the medical condition that you are challenged by. So really, this has been such a fun few weeks for us. We are just going overboard with skimming the literature on essential tremor. We're so excited to put it together into an understandable, applicable program for you all on Friday. So like I said before, we've got 4 hours of content. You can check it out and read all about our lectures and see if it's a good match for you. Part of your registration fee is a donation to the 2 major essential tremor organizations, the one in the UK, the one in the US. I am so very excited to see you all on Friday. Dr. Renfro and I are so excited to be a part of your journey. And we are going to do our very best to really demystify these non-motor symptoms of ET. That's our first goal. But what really is in our heart is to help you do something with that information that truly affects the quality of your life and how you interact in the world and your own experience with yourself, and really just trying to minimize the impact of this very complex, poorly understood disorder so that you can shine more and be in the driver's seat and kick ET out. ET should not be in any way controlling the decisions that you make and deciding where or where not you feel comfortable going. So we're actually going to get down to the nitty-gritty with some skills. So I am so appreciative that you all are here. The next time we'll be talking on Facebook Live is going to be just a live question and answer based on the webinar. So if all of you are hopping over to the webinar Friday, make sure you come back here next Wednesday, because we will be answering any questions that we weren't able to get to on Friday. So thank you guys so much. I always appreciate spending this time with you, and I will look forward to seeing some of you on Friday. Take care. Bye-bye.